Scott, good morning and welcome. Thank you so much for joining me today. It's such a pleasure to be talking to you. And I wanted to, first of all, say congratulations on your beautiful clinic, Ascension Clinic. It really is exemplary. It's very beautiful. I also wanted to congratulate you on your work, because the thing I hear again and again is your patients raving about this beautiful, polished, perfected, but entirely natural look that's become your signature. And I wanted to ask you, Scott, about your journey to become a cosmetic physician. What was the inspiration for you to study and then become a practitioner of cosmetic medicine?
Yeah, no, thank you for your kind words, Richard, and thanks so much for having me here this morning. In answer to your question, I guess one of the things that really inspired me to go down the path of cosmetic medicine was the creative aspect to it. I've always been quite a visual person, and I kind of liked the sort of amalgamation of, artistry and medicine. But I guess the other aspect to cosmetic medicine that I really enjoy is the part of making people feel good about themselves.
Yes.
So our patients leave, they're happy, they're feeling good, and that feels good. So yeah, a combination of those two.
Wonderful. And would you say when you were younger, when you were a student, were you an artistic person? Because I mean, it's an automatic assumption that as a doctor, you're an able scientist and that, you're very, very accomplished in those scientific endeavors.
Hmm.
What about the artistic side of your work, which is, we'll talk about that later, but was that always there with you?
Yeah, it was. So I've always had a bit of an artistic side to what I enjoyed doing, and I actually more sort of fell into medicine than anything else. I was going down the arts path, and so this actually made a lot of sense. And I certainly like the scientific aspect to medicine. But yeah, cosmetic medicine is a nice balance between the two.
It is, isn't it? And so you have this,
Mm.
you have to have the foundation medical knowledge, anatomy,
Mm.
physiology, and so on, pathology. But you've also got to have a good eye, I guess we could describe it as. So
Definitely.
today, Scott, we're going to talk about the aesthetic, the medical, but also
Mm.
I guess, psychological and the philosophical side of aging. I mean, aging happens to us all, and I thought we could address that question first. Could you talk to us about your personal philosophy of aging? How do you view aging, and how does that influence the way you treat your patients?
I mean, I guess the one of my biggest aspects to the philosophical side of aging is that everyone ages differently,
Yeah.
and that we need to tailor our approach to the individual patient in front of us. And so that can be in terms of the filler treatments that we do, but it's also true of the skincare program that we put together. And that's where I guess Rationale works so well, is that it has options for different people depending on their skin concerns, and they
Yes.
may not need every product, or it may not be right for them at that particular time. But we have a lot of options where we can really tailor it to the person.
Mm.
And I guess the other aspect to it is in terms, I'm careful to use the term anti-aging, because we're not really anti it at all. We really just want people to age well, and be the best versions of that
Yeah.
age.
So I guess, in the 20th century, we began to pathologize aging, to see it as
Mm,
a disease, to see it as something therefore highly undesirable, and
right.
something to be treated or eradicated. But of course,
Mm,
we've evolved since that time. But I wanted to talk to you about a little bit about, so we understand that your approach is very much case by case, looking at the individual, their face, but also who they are as a person.
mm.
I wanted to ask you how you, as I said earlier, you're known for this beautiful natural look that you stand for and able to deliver for every patient. But talk to me about your aesthetic. Is it very much a matter of taste? So your taste married to what the patient wants, or are there actual rules, aesthetic rules that, how architects follow the golden mean and so on? And are there, I guess, objective measures of aesthetics that you also embrace?
Look, it's probably a combination of both, to be honest. I think every clinician has their own take on what looks good. And certainly, my personal aesthetic and the aesthetic that we created Ascension is around a less is more approach, a really, really natural aesthetic, one that is, in line with people's age and looking the best version of that age. You know, beauty and aging is subjective, and there's no right or wrong. And it is very personal to each person. So, you know, who am I to say what looks good for someone? But there are limits to that, and I guess there's a point to which, you know, I think we do have to say no.
I guess that as a cosmetic physician, you have a standard that you want to stand for and a look that you want to be known for, which for you is very natural, a less is more approach.
For sure. And there's a spectrum within that, you know, that will still look good. So I guess if it's staying within the realms of normal and what you as the practitioner is comfortable with, then you can be guided by the patient in front of you and what they want, to some extent.
The good work is appreciated but not noticed. In a sense, almost like a conscious view of the individual. You see that person looks great.
I think it is probably a reflection of the clinician as well. You know, if your clinician looks distorted and alien-like, that's probably what they consider is normal. And I think as an industry, like, and this is a really positive thing, but I think as an industry, there is a swing back to a more natural aesthetic and a more natural look, and people are more aware of the things that look abnormal. And sometimes you can't even quite put your finger on what it is, but, you know, we as clinicians know that, you know, when we start distorting the anatomical units of people's faces and we completely get rid of lines and, you know, do things like that, those are the things that make people look a little bit unusual.
Yes, odd. Yes. So there are rules that you follow, but they're very much subjective in a sense of your interpretation of them, married with your patient's expectations. I'd like to touch a little bit now on the medical side. So I guess what I'd like to explore with you here is what modalities do you deploy at Ascension, and which ones do you find yourself that you're coming back to again and again and again to get a great outcome for the aging face?
Yeah. So without any patient who comes and sees us at Ascension, the first thing we'll do is a full facial assessment for them. So we'll look at the various aspects to their face in terms of aging, and I take a very layered approach to that. You know, looking first at you know, the skin quality. Is there pigmentation? Are there blemishes? Is the skin looking dull? And then the ways that we will treat that is, you know, first and foremost is skincare and sun protection, of course. And as you know, we use predominantly Rationale here. But the other modalities that we'll use to treat that are our energy-based devices and lasers.
Yes.
So going deeper to that, you know, as we age, we'll lose structure from the face. So the deep fat pads will shrink. We'll get changes in the bony structures. So we treat that with dermal filler predominantly, and thread lifts sometimes. And then as we age, certain muscles will become hyperactive. And so we might treat that with, you know, anti-wrinkle injections. So, you know, when we're looking at the aging face, there's often a lot of things that are going on. And so you need to, you know, often come at it from different angles and take a very multimodal approach.
Yes. So it's very much depending on the anatomical changes that are occurring as a result of age. Touch on that a little bit more later. And so I guess what you're saying is layer by layer of the skin right down to the bone, you're analyzing the changes that occurred and then creating a customized treatment plan that addresses each of those needs. I love the fact that you address all of those areas, because it doesn't happen sometimes, as we've mentioned before, and it's always an unsatisfactory result. You know, you can have great skin, but if you've got facial lackness, or there's, you know, heaviness in the face that's, you know, not attractive, then, you know, there is, I guess, a duty of care to give the patient all of the options, is there not? And then to work with them to tailor the plan.
Definitely. And it's interesting because people, you know, patients will likely come to your therapists with the skin being at the forefront of their mind, whereas when patients come and see me, it's often because they, they're looking to do dermal fillers or anti-wrinkle injections, and sometimes they're not even thinking about their skin. And so the way that I'll always sort of phrase that to them is that, we can do all the things in terms of structure and foundation and contouring with the face, but if the canvas or the skin is blemished or has pigmentation, then it's going to detract from the overall appearance.
I always say your skin is your calling card. It's the first thing to see about you. So it's very reassuring, and you are absolutely to be commended on taking that, as you say, multi-layered, multimodal approach to the aging face. So talking a little bit in more depth, if you like, about skin, what are the most common skin problems, or I guess pathologies, that you see at Ascension? What's the thing that presents most to you?
One of the most common skin conditions that I would say would be skin laxity. And, as you would be aware, Richard, it's kind of a big cause. It's really from an overall decrease in collagen and elastin over time. And so, the way that I would approach this is twofold. One is to try and stimulate more collagen. And so we do that with skincare actives, namely topical vitamin C in the number 2 serum, or retinols in the number 6 cream, but also by protecting the new collagen that we're producing. And we do that with sunscreen. And so approaching it from both angles, we're producing more collagen and protecting the collagen we're making. So there's a net improvement or increase in collagen production.
And isn't it fantastic to think that that's very much something that we can influence? I think it's going to be an interesting future that we're addressing now. This whole Rationale is very involved in a lot of research into epigenetics, which, the things that we do that influence our health. And I think, solar damage, we say this a lot, but about 80% of what we see with facial aging is caused by the sun. So all the things that you're seeing, if we have a skincare philosophy that looks at your genetic responses to the sun and what you can do, as you say, to protect new collagen, down-regulate the enzymes that break down our collagen and protect that new collagen. These are very important strategies in addressing the aging face. What's the one thing you want every patient to know about the aging face?
The one thing that I want everybody to know, I guess that everybody ages, and that we shouldn't look at aging, like we said before, as a pathology. We just want people not to look 20 for the rest of their lives, but just to look like the best version of their age. But I think kind of one of the things in terms of how we can address aging would be, especially in Australia, more than probably anywhere else in the world, is how important sun protection is for prevention of aging, as you mentioned, across the different layers of the face. And we see that, you see that if you see a patient who's lived most of their lives in the Northern Hemisphere and hasn't had that intense UV exposure, the signs of aging we see in the skin and the face in general are just so much decreased. So I guess one of the things that I would tell people, if I could, would be, just to, at the very least, incorporate sun protection and an SPF into their day-to-day routine, regardless of what they're doing.
Just talking a bit about your personal skin journey, what was it? How did you discover Rationale? And what was your own journey to learning about Rationale and using Rationale yourself and recommending it for your patients?
Yeah, look, I came across Rationale about 10 years ago now. It just actually happened to be at the very first clinic that I started working at. And so I guess I was initially drawn to it, but because of the evidence-based aspect to it and how it was, backed by science, and it made sense to me coming from that medical background. But I guess the thing that's kept me coming back all these years later, both in terms of myself and my clinic, is the results. It just delivers on the results. And I think that's what all of our clients who have used Rationale for years would say, is that it just works.
In the early days of cosmetic medicine, cosmetic dermatology and so on, was treated with great skepticism, because we didn't really think that something that was non-invasive could make such a difference. But of course, like everything else, skincare done well is a function of time as well as actives doing the right thing. So I guess, as some of our dermatologists like to say, success with your skin depends on doing the same right things day after day after day after day. It's the consistency that counts. Whereas a lot of the, I guess, the medical treatments that you do, Scott, are very much as needed basis. So could I talk to you a little bit about the concept of treatment plans, which seems to be very important at Ascension, as opposed to just come in and get something done and see you later. You see every patient as someone that you feel a duty of care towards for the rest of their life, hopefully, to help them address their skin health and aging. So how does it work with you? When you mentioned earlier that when you see a patient, you look at the whole picture, the holistic, what's happening here. And so how does it work with skincare, for example? So how do you decide which formulations the patient's on, or do you have a therapist that you refer your patients to that can spend all that time with the patient on skincare? How do you handle it? Because there's so much to do in that consultation, I'm sure.
Yeah, no, there is. And then that's exactly what we do. So every new patient that we see at Ascension will have a full facial assessment. And so part of that assessment is looking at their skin. And so, we'll go through their skin concerns, both in terms of what they see as a concern and what we see as a concern. And then essentially we'll put together a program tailored to those concerns. So often the skin consultation is with myself. Sometimes it's with my dermal therapist. But either way, they're getting captured and looking at the skin as part of that initial assessment.
Yeah, fantastic. And can you tell us, Scott, some of the results you've seen, maybe with yourself or maybe with some your staff or patients that you've put on Rationale? Well, you mentioned before that it works, and that's wonderful. And we certainly agree that the results are there. But what can patients that go on Rationale expect to see from your clinical experience?
Yeah, I think one of the really big things that I've noticed with patients that are on Rationale is how even their skin tone is, both in terms of like the pigment in the skin. Often the uneven pigment will fade over time. Certainly their skin is more refined in terms of the pore size. They kind of have a bit of a glow. So that dullness that you get with aging, definitely I see that reversing a lot. And then just the overall appearance, I guess the skin quality in general improves.
We always talk about skin health versus skin beauty, but my personal philosophy is that they're flip sides of the same coin. When your skin's healthy, it's like your health. When your body's healthy, it looks good. When your skin's healthy, it looks good. Like, what are your thoughts about relationship between skin health and beauty?
Yeah, I mean, I think they're intrinsically related, aren't they? As you mentioned, when your skin is healthy and it looks good, you feel good.
Yes.
So that the two are intrinsically related.
I guess my last question for you is, what area in your field, because you're always abreast of the latest technologies and treatments that are available, but also with a very critical eye to what is going to work and give you the best result and do no harm. What could I ask you about just one area maybe that's really exciting to you at the moment? A technology or a modality or something that's you just think, wow, this has really grabbed my attention. I want to know more and learn.
Yeah, for sure. So one of the areas I think that's really exciting that's only recently come to Australia, but has been overseas for quite a number of years, are collagen stimulating injections. So a lot of the stuff we do with skincare is about, as we mentioned, stimulating collagen, lasers, stimulating collagen. And previously, it's been really difficult to stimulate collagen in more in-office procedures. A product we obviously can't talk about the drug names, but injections which we inject into the skin and stimulate collagen. It's really exciting because areas where they've traditionally been quite difficult to treat non-surgically, so around the mouth, down onto the neck and décolletage, we're getting really, really amazing results with these. And the thing that's quite cool is that it's utilizing the patient's own biology to produce the result. So, rather than it being a filler, it's actually stimulating the skin's fibroblasts to produce more collagen and elastin, rather than the product itself producing the result. As I mentioned, it's actually stimulating the fibroblasts within the skin to produce more collagen and elastin. So areas where we get a lot of signs of aging around the mouth, traditionally really difficult to tread that fine line between treating someone with filler and not overfilling that area. It's a really nice happy medium.
That sounds incredibly exciting, Scott, and we'll stay tuned to hear more. Scott Allison, thank you so very, very much for joining me this morning. And thank you for sharing all of your wisdom and knowledge about the 6 pillars of skin health and about how to really see the aging face. And I guess it comes down to the quality of the consultation that your patients have with you to really spend that time and literally go deep into what's happening in the aging face, and then developing an individualized tailored plan for the long term with your patients. So thank you again for your time this morning, Scott. It was lovely to see you, and congratulations once again.
Thanks so much for having me, Richard.